Whenever you are.
Okay. So I am talking to Miss Lara, or I like to call her Sensei Lara, because Lara is not only the foodie pharmacist, but she's also my CNS supervisor.
I am.
Yes.
It's my honor to be your supervisor.
Thank you, Sensei.
And you're teaching me so much about the relevance of nutrition and eye health. It's pretty cool for me too. So just so you know.
Well, I guess that's where the conversation starts, where when we think of nutrition, right, we think of that general nutritionist or somebody that we're, correlating it with some sort of weight loss or a program. And that's kind of a little bit dated, because now there's so many subspecialties, and you're also well versed in other specialties, not just pharmacy, but that can really incorporate the proper nutritional targets to improve a condition.
Yep.
And I think that's where the problem is in medicine, where we subspecialize so much and we lose that cohesiveness. And, the fact that, eyes are, directly correlated. It's a direct correlation and direct connection to diet and lifestyle, of course. But, we don't really talk about how to help ourselves in some of the most important subspecialties that we have so many problems with.
Right.
So I think that's one awesome thing, where you really are able to help these subspecialties really bring in that nutrition part, because it's not a separate entity. And that's where I think my focus is I don't want to separate the two. Why not bring it together?
And that's the ultimate goal, right? Like when we talk about personalized nutrition and personalized medicine, we want the two to be cohesive. You're going to have folks, especially in the nutrition world, that are going to have specialties and areas of focus, passion projects, and areas that they just naturally gravitate and learn more about. But at the end of the day, I always say, like, you have to be a little bit of a generalist too, and you have to be able to view it from the scope of, yes, your practice, but you have to be able to connect all the dots, and you have to know a little bit about everything in order to be able to apply it. So yes, your focus is the eyes, but that doesn't preclude you from having to understand how hormones fit into that picture, how liver and detoxification and kidney function fit into that picture, how gut health fits into that picture with the microbiome. And so it's I call it like a two-sided view, where you're on one side looking at it from your specialty and your lens, but then from the other side, sort of zooming out and looking at the full picture. And that's what I always feel like I'm struggling to do, right? Zooming in on the piece that I really want to specialize in, and then zooming out to see the forest for the trees, right? Like, and that's what we're constantly doing, zooming in, zooming out. Sort of like your little optical machine thing that you do with people to see their vision.
The one and two.
You see how I brought it together?
1 and 2. Yes. Yes. There's a lot of things you could play with eyes and boarding. There's a lot of fun little
I love fun.
But yeah, so you're totally right. And that's where a lot of stuff, a lot of conversations are lost when we just look at the one issue that you're going into your specialist for. And sometimes it's not so much your specialist is going to have every answer for you, but just give you suggestions to look into other avenues that you would never have put those two and two together. One actual, I like that you brought up gut health, and it's not a specific thing, but there is, I see patients that have macular degeneration. And of course, there's a huge support with certain type of supplements and lifestyle changes for macular degeneration. But some of these patients are not absorbing their supplements.
Right.
And guess what? They're over 65, which puts a whole nother animal into play. They have, poor HCl, or, they don't have good digestive tract anyway. They're constipated. They have IBS. So it's almost like yeah, we, on the surface, obviously sounds good and easy, like just do this and have a nice day, and hopefully it'll help you, versus, you know what, why don't we look at the inflammation with the problem of the diet and trying to boost all your carotenoids, et cetera, like through the gut.
And I would argue also the benefit of having those carotenoids and those antioxidants coming in from your diet versus coming in from a supplement, right?
Absolutely.
I would also argue that if your gut can't absorb it from the supplement, it's probably not absorbing it from your diet to begin with.
Yeah.
And I always say, like, I can give you the best diet in the world. You can be 100% compliant. That doesn't mean you're going to get 100% of the benefit of that diet if your gut is not doing its job and absorbing things properly. And then one more layer to add to that is the body doesn't know what to do. It doesn't go, oh, this person's going to an eye doctor, then I should take this beta carotene up to the eyes, right? Like, it's going, where do I need antioxidant power right now? And that might be like in your ankle, you know? So wherever that stress is, it's going to divert those antioxidants to that. And it's going to probably prioritize things like your heart and your liver and your kidney over your eyes. So there's something to be said also about the overall burden of what we call the oxidative stress of the stuff that's causing you to have an increased need for antioxidants, and where it's diverting those resources. And is it then is that why it's not getting it to the eyes and you're seeing some degeneration happening?
Yeah. And it's so important to know the general inflammation of that patient, because there's never a patient who's, you just don't get that, where it's just, your run of the mill macular degeneration and there's zero anything else.
Right.
No other, I am healthy as can.
Triathletes,
there might be some cases, but I don't see it.
Yeah.
So yeah, it's an
typical.
Overall health consciousness on that case, and not just throwing a supplement, but that's what is the protocol typically in a general medical practice, where you just give them whatever supplement was the easiest to find. And then, going into supplements, you could even get, I get a little more nutty, because I find supplements that they have the lutein, zeaxanthin, and then they're boosted with beta carotene, and they conflict. So this patient's like, I am doing my job, I am taking my eye vitamins, and I'm like, great. And then I look at it and it has ridiculous amounts of beta carotene, which competes with the lutein, zeaxanthin that we need to get into the eye, and the absorption is poor of the top two carotenoids versus the beta carotene carotenoid. So
in that case, is that specific, like, is that the lens you're putting on in terms of, for your eye health, the lutein, zeaxanthin is what's specifically useful, and taking excessive amounts of beta carotene is going to then compete, and so you're not going to get the eye health benefit. You're probably going to get like other antioxidant benefit, but not specific eye health. Is that what you're saying?
Yes, exactly. Okay. And also then there's enough research with beta carotene and smoking, where the beta carotene actually turns into not an antioxidant, but the opposite, and it turns into more of an oxidant. And that is linked to increased cancer rates and things like that.
Funny you bring that up. I literally was just reading about this the other day in the context of vitamin E. And the theory is that it's, if you're deficient in vitamin E, which is it's a fat soluble vitamin, yes, but it's also another antioxidant.
Yeah.
That if you're deficient in vitamin E and you ramp up the beta carotene or vitamin A, then you risk additional oxidative stress, because you don't have the vitamin E to do its job in like sequestering some of those electrons that end up being produced as a result. And so it's interesting. Again, it goes back to what I was saying earlier about the benefit of a whole food approach or a whole antioxidant approach and a balanced antioxidant approach versus this sort of cherry picking of antioxidants to support a particular need. And I think also it's worth talking about that deeper conversation of the gut microbiome and how we're actually, so there's two pieces here, right? There's one, what are the antioxidants actually doing? They're sort of acting as phytonutrients that are going in and modulating physiological behavior. In other words, they're going in there and they're telling our body to fix, repair certain things and to reduce damage. So one thing they're doing is sort of acting as a fire hose on a fire and sort of quenching that. But they're also communicating to our genetics, right? They're modulating our epigenetics and they're communicating, hey, turn this on, turn this off, fix this, hold on that, right?
Yeah.
And so that's part of it. And then what I have been finding absolutely fascinating is the more recent research is saying that actually they use a medium, and that's the microbiome. And so they actually are communicating not directly necessarily to our genes, but via our microbes. And the microbes are actually interfacing in between what the phytochemicals are doing and what our genetic response is, which starts to like, it was like a huge aha moment for me. I'm like, no wonder you can't see a benefit from increasing somebody's phytonutrient density. Like you can't just say, eat a bunch of, eat the rainbow, eat lots of vegetables. But if the gut is still unhealthy, if the microbiome is still unbalanced, you don't see the same response. And so it was just such a huge aha moment for me because it's the bugs that are needed to implement the phytonutrient benefit and the nutritional benefit in general. So
it makes so sense. It makes so much sense. Because that is one of my ultimate, I think if we want to really hone in on just AMD, which is the number one age-related macular degeneration, one of the number one cause of blindness over a certain age, 60, 65. So we want to hone in on why these patients have it in the first place, right? And go into obviously diet and oxidative stress from smoking, UV, all these exposures. But if we actually forget about the gut health, which is always not even, you don't even hear a word about gut health in AMD, which it really should be a top conversation, because even if we go simplistically and just say, these are the top carotenoids that help the eye, but if you can't digest it properly and it's not doing what it's doing and it's not talking to your genes, and then what are we doing?
Why are we here?
But that's where, I mean, I started doing some stool profiling here. I mean, I think it's, the conversation is so repetitive where whenever I see a patient with a lot of eye inflammation, I would say, I mean, this is not obviously scientific, but majority of the time, they don't write it on their intake form, but I say, how is and then it goes, oh, I just have diarrhea every day, or there's something.
It's always something.
Yeah. Oh, I'm looking for a good gastro. Oh, there's always something. And I totally agree with you that there's probably some sort of sense. I mean, obviously the microbiome, the genetic profile of the microbiome is like trumps our genetic profile, right? Yeah. And so it's, why wouldn't it connect in that way too? But so then let's talk about the earlier point, and that's kind of where I wanted to gear this conversation is, so let's say you are at that age bracket and things have already started and you're already on that unfortunate, train of going down inflammation in the eye, but we're not talking about being proactive younger. So where are we? So when our gut health is maybe a little bit better, right? And maybe we have better systemic kind of way of absorbing these carotenoids. And now we have other oxidative things like our phones,
right,
and our LEDs and being indoors and, a quarantine.
Right.
So why can't we at least minimalistically try to help at a younger age to be proactive, to have the proper carotenoids in the eye?
And isn't eye health also, isn't it in some cases, it's sort of an early indicator of general oxidative stress. Did I read that somewhere? Am I right about that? That you can use that as a barometer for certain oxidative stress?
Absolutely. And right now, one of the biggest connections are, or they're trying to really make it pretty easy to use in a clinical setting, is markers for Alzheimer's in the retina.
Mm-hmm. Mm-hmm.
So, the ocular tissue, or just, first of all, where else in the body can you see a nerve that's exposed? So we see the optic nerve.
Yeah.
Where else do you see blood vessels without any skin? So we see the vascular system. We actually see the flow. We could see the pulsation in your vessels in the eye.
Yeah.
So, I mean, you can argue a lot more than just having that imbalance of oxidation, but there's so many connections that can be made by just looking into the eye.
Well, I could see the dementia Alzheimer's piece, because one of the, if you read Bredesen's work on his book, End of Alzheimer's, he talks about the 5 types of Alzheimer's. And one of the most prominent ones is vascular degeneration. So if you can sort of look at the vasculature in advance and see what it's doing in advance, that could give you a clue. Totally makes sense to me. It could give you a clue as to what might be happening, in the vasculature leading up to the brain.
Yeah, because the retinal tissue is brain tissue.
Yeah.
It's not, and that you're looking at your brain through your eye.
That's fascinating.
It is fascinating. And it's, I mean, we're just at the early tip for, studies in that department. But yeah, so going back to the lutein and even lutein is, it's great for the brain. Cognition. There's studies that have come out for cognition with lutein improvement.
Wow.
So it's not just an eye vision. No, it's one of the few carotenoids that are in the brain.
Yeah.
And so there's a lot more to it than obviously the macula, which, as I said, that's where the majority of the lutein zeaxanthin concentrate. But I think it's just the early phase of all of this, where we're going to see so much more information. But I think for us to be proactive at this point is to try to get as much as we can naturally through the food and diet. A lot of people think, obviously spinach and kales are top notch for lutein. But I actually did a smoothie video just last week, and I cooked my spinach.
Yeah.
And chopped it up and put it in the smoothie.
Why did you do that?
Because guess what? The nutrient value goes up.
Interesting. So, Dr. Deanna Minnick actually talks about this. And I know she was one of your professors at UWS. And one of the things that, she said that I heard her say this years ago, and it's stuck in my brain. A lot of times these phytochemicals are released with heat. So if you've ever steamed broccoli, you put the broccoli in, it's got this sort of dull green color to it with it's got a little ashiness to it. And then you steam it and it pops. Right. That green just comes out. And she's like, those are the phytochemicals activating. And so this idea that we have that we always have to eat our food raw, and that's the best way to preserve its nutrient values, actually false. Some nutrients decrease, you lose some, but others are actually activated by that. And part of it is that phytonutrient profile. It's actually activated by a little bit of heat.
Yeah. So, implementing those little tricks, especially for patients who are already suffering, obviously, we want to up whatever they're able to do on their daily routine. We want to give them the highest nutrient value, right? Naturally. And also teaching a little bit of that population of not to be afraid of fats, because their fat is fear for them, because they've been brought up with the anti-fat.
The 90s, I was there. Yeah.
Yeah. So, but this is again, going back to the carotenoid absorption part of it, they're actually fat soluble. Right. They are, because they're fat soluble vitamins are derived. Yeah. They turn. Yes. So that's, it's getting a little ridiculous, but it's almost like a simple, I tell my patients, I go, I love how you're having salads, but don't get the no fat dressing.
Yeah.
Because again, it's the power of that combination to get it into the intestine with a fat carrier, which is a little bit of EVOO.
And this is where my sort of bias comes in, because I'm already thinking, well, are they even absorbing those fats? Because if they're having digestive issues and they're not absorbing the fat, they're also not absorbing the fat soluble nutrients that go along with them, right? The carriers.
And I mean, who has their gallbladder removed? Who's been on proton pump inhibitors for, I don't know, 3 years straight at least. So there is a lot more aggressive dietary changes with actual absorption. I mean, if you really look at the absorption piece of it, you can really get into serious conversation with these patients on how they're eating. Not just what they're eating, but how they're eating it.
It sounds like there's 3 barriers, right? The first barrier is, are they eating the nutrient-dense food that contains those carotenoids? 1.
Period. Yeah.
Barrier 2, are they eating enough fat to carry those nutrients and absorb it if they do eat it? And 3, what is their gut health look like and their ability to actually leverage that content? So 1, are they eating the carotenoids? 2, are they eating the fat carriers? And 3, are they absorbing the fat carriers with the carotenoids?
Yeah, and where we stand medically on we barely get to number 1.
Right.
So,
and we haven't even scratched the surface, Neda, yet about whether or not they're having a quality supplement. Like, is that supplement even a good quality of zeaxanthin or lutein? Or we haven't even gotten to that part yet.
Well, yeah, I've very often taken people off supplements. I mean, I'm like, if you don't come in with your supplement, we can't have a conversation, because I need to know what it is.
Mm-hmm.
And oftentimes I'm like, guess what? This is garbage now.
Oh, I'm glad you brought it in. It's going in my trash.
Yeah, I'm so sorry you spent so much money on that. But, but that's, I think of it as value. And I'm a coupon lady. I like my coupons.
She is gone.
I've
known her for a very long time. She really is a coupon lady.
I don't like people buying supplements that are not good, or they're not getting value out of it. It actually hurts me on that kind of end too, that, some of these patients they're just on Social Security or whatever. And a lot of these supplements, they're not supported with Medicare coverage. So even though I think it should be, because
most of them are not. Yeah,
most of them are not. So
and they're expensive. They're not cheap.
Very expensive. Yes.
Oh my gosh. Like a little bottle for 30 days can be like $20, $25 easy. And that's not even the good stuff. That's like mediocre stuff. So they are definitely expensive. Do you have some favorites? Do you have some favorites?
I actually, there's a few. It depends on the patient's like nutritional status to begin with. I do like Eyesight. Actually, one that made a cool version was Eyesight by Zymogen.
Oh yeah,
it hits a few of the top stuff. I do also like Zeavision. That's another one that I prescribe. And Pure Encapsulation has an eye version that's really good too. But then again, it also depends on the status of the patient. So if it's more of a pure lutein and zeaxanthin boost, where they want to help really promote improve macular health against blue light, because that's another conversation, not just age-related macular degeneration, but blue light therapy, where you are trying to boost your macular zone to combat blue light oxidative stress. Because that's another hot topic, where digital exposure, what does that do, right?
I'm curious. We've been super screen focused, I guess, for lack of a better, like we've been using screens. It's been gradually increasing, but I'd say it's at least 15 years that our screen time has significantly increased, particularly when, smartphones came out, but even laptops and, iPads and things like that. I'm curious if you've been seeing an increase in degeneration due to that, or any other shifts that you're seeing as a result of screen time. We all know, screen time disrupts sleep, and we know that screen time can add to anxiety, especially depending on the content that you're viewing. But I'm curious from a eye health perspective if you're noticing a shift as well.
I mean, I think right now it's still premature to connect it with actual damage. There are some mice studies that are out that really do connect those two, where blue light, but unfortunately the emission of the blue light was very high. So it's like if you go out in the sun and you stare at the sun, your eyes are not going to do so well. That's blue light on steroids, right? But the argument is that not so much the percentage per screen, it's the length of time and the environmental. So, meaning you used to watch, be on your phone, let's just say an hour. And now your phone is your computer. Right. But now you've changed every bulb in your house as well, right?
Right.
And so it's the added, and that's where there's a lot of controversy on what it's really doing damage-wise to the retinal photoreceptors, because there is always a balancing act of that, oxidation balance of how much can it take, because that's the goal, is for these carotenoids to absorb all that blue light before it hits the rest of the retina and damages the photoreceptor line. And what, going forward, we don't know, but we do know that there's protection with lutein and zeaxanthin.
Okay.
In general.
So lutein, zeaxanthin, trying to get them out of our food. I'm trying to protect my eyes, girl. What are we saying here? We want lutein and zeaxanthin in food sources as much as possible. There's some supplements out there if we need a little added boost, but food first. I think we're on the same page with that. And then blue light blockers, do you think those are an added benefit as well?
Blue light blockers is a very complicated conversation because there is no standard of care.
Okay.
So when I say that word, or, there's no, this is, you might see something that says blue light blocking. You don't know what percentage it's at.
Yeah.
And then we have the visible spectrum, and there's the highest level, usually around 435 nanometers. Where does those blue light glasses block at that level?
Okay.
They don't tell you.
Okay.
Unless there's some companies do. Okay. And those are the ones that, and it goes back to vitamins. So it's like, this is my vitamin magnesium. Oh, that's great. What does that mean?
Right.
Or, my multivitamin, which has goods and bads. But then again, with blue light glasses, how much are they blocking?
Right.
What nanometer is it targeting on the spectrum? Because obviously the higher the energy, the more damaging it is.
So basically what I'm hearing, Neda, is that you don't trust don't put the blue light blockers on and assume that that's protective. You still need to focus on the antioxidants, and you still need to focus on the carotenoids.
Unless you know that company is well-researched and they tell you the answer, what they're blocking, how much they're blocking.
Yeah.
So that's the other part of it, that you have to just know what company you're dealing with, and are they actually doing the right thing. Yeah. And I'm actually doing a fun blue light thing with Kevin.
Headphone. That blue light glasses, although they could be helpful, you don't know exactly how much are blocking. So it still goes back to making sure that you're getting adequate antioxidants. Well, that you're getting adequate antioxidants as an insurance policy. Don't just put the blue light blockers on and just assume, that's it, I'm using blue light blockers that protected my eyes. You still have to think about whether or not you're getting your antioxidants in as an added measure.
Yeah, so with blue light glasses, it's really just knowing what quality glasses that you're getting and where that blocking is actually occurring and how intense that blockage is. But having your internal blue light glasses on, which are your antioxidants, they're the natural blue light blockers, right? and they're there for a purpose, you know? So overusing your eyes on electronics, we know for multi reasons, not just eye damage potential and also sleep deprivation and things like that. But we also want to know what else can we do to reduce digital eye strain and just not feel burnt out by the end of the day visually. I mean, we don't do anything to support our eye system, right? So it's a conversation that I really like to have. We do so much to maintain, you know, maybe if you're a female, you do a little extra for your skin and your teeth and all these maintenance things, but we
I don't
never
think that's strictly female, by the way.
I mean, you know, yes. Now, actually, you're right, because now it's becoming an everyone thing.
Yeah. Mm-hmm.
And dental hygiene, but we're not really thinking about the visual system.
No, we're not.
And ask anyone, take one sense away, which one would be the last on their list?
That the one they worry about the most, it's the eyes. I feel like there's a study about this actually that's a top phobia for people is to lose their vision.
Yeah,
Public speaking and
scary. I mean,
right. Loss of vision is one of people's major phobias.
Yeah. So, but not to say that if you wear blue light glasses, you're going to not have loss of vision, but we're not doing anything in the awareness category of it.
Yeah.
And
well, isn't that, not to get on a soapbox about it here, but isn't that the problem with healthcare? Period.
Yes.
End of statement. Is
Absolutely.
that we don't talk about what you can do to prevent damage. We don't talk about the importance of whole food. We don't talk about the importance of antioxidants and phytochemicals. It's sort of dismissed as being a luxury or something that we can't have. And this has sort of been the last couple of weeks, I've been really kind of digging into this and in all the conversation about equality and access, particularly when it comes to healthcare and the larger, you know, sort of picture in terms of social movements, social justice, this idea that access to fresh fruits and vegetables, access to the sources of these antioxidants that we're talking about, it's become commoditized. It's become a luxury. And to be able to afford that and have access to it and be able to actually get to the store to get it for a lot of people is not realistic. And I am not an eye expert, but I'm willing to bet that that's probably where you see the largest disparities in terms of eye health are probably the folks that probably don't even have access to that stuff and definitely couldn't afford the $20, $30 supplement to protect their eye health to begin with. Right?
Yeah, there's a huge disparity.
So I think that we're actually like, this is a really great point about the fact that it's not unique to eye health, but I think eye health is, we really don't make the connection between the impact of diet and, you know, we're talking about the gut or detoxification or environmental toxins. You know, we talk about the energetic impacts, mitochondrial health, all these pieces and how they then relate to eye health. That's definitely, that conversation isn't happening. And we're definitely not talking about the impact of a healthy diet and access to a healthy diet, especially on eye health, in health in general, but especially not on eye health.
Yeah. And I kind of use these tactics, I guess you can say, you know, with patients. You know, it's almost like, okay, obviously smoking is horrible for everything, right? But it puts you at a very high rate of wet macular degeneration versus dry, which, you know, you get a lot more vision loss with wet. But, you know, having that conversation at a younger age where, guess what? Now you have a high risk of getting wet macular degeneration over a certain age, and you can go blind.
Yeah.
So it's like that fear of like, where would we, you know, there's these things that we can do preventatively at a young age that can help preserve our vision, and we just don't talk about it. And as you said, because we don't do that preventative part. And I would say all we need, it doesn't need to be this huge, you know, project. All we need is just a little bit of hints from our general doctors who don't have much nutrition background. They don't have to get so aggressive, but even if they can just plant some seeds
And send them over to folks that are
That,
talking about it, right? Like,
yes, if
yeah,
we can even just start there,
yeah,
that's great.
yeah,
I'll take that.
absolutely.
At this time.
Yeah.
And, and who knows, maybe, after all this conversation on how to improve your immune system and things like that, and we really want to stay healthy right now for obvious reasons, maybe there will be more of a shift in that aspect. But again, time will tell. So yeah, but I think you really hit the nail on the head there. And it's about prevention, really. It's not fun to deal with the disease
No.
state. It's
But I
so
think,
much easier preventative.
yeah, and I think humans are better at dealing with a problem when they can see the problem, when it's tangible,
Yeah, of
right?
course.
And so prevention is sort of unsexy because
Mm-hmm.
it's like you're thinking about a problem that's going to happen in 10, 20, 30, 40 years.
Mm-hmm.
And, I don't want to think about that. Or,
Yeah.
it's so far away. One more day. I'll start next week. It gets really easy to procrastinate.
Mm-hmm.
Whereas we're much better at dealing with an issue when we physically see it. And that's why a lot of people are inspired when they see a family member get sick. And all of a sudden they're
Yes.
like, I don't want that to happen to me. It becomes really real and it has a personal connection. And
Mm-hmm.
so it starts to inspire change.
Yeah.
Or if they know for a fact that they have maybe certain genetic risk factors, or they've been told, hey, if you don't watch what you're doing, eating, etc., that XYZ is going to happen, I think people get a little bit more serious. And I think I would love to see, and you probably agree with me, I'd love to see this conversation happening in like teens and people in their 20s and thinking like long term, not only how can we protect you from losing your vision, but like potentially optimize your vision, right?
Mm-hmm.
Right? Like optimize your vision and therefore optimize your health at the same time. Use that
Mm-hmm.
as a window to an overarching healthier everything.
Mm-hmm.
Yeah, I'd love to see that happen. You also got me thinking, on a side note, I would love to have another conversation
Yeah.
about metabolic disease and eye
Mm-hmm.
health. I feel like
Which
there's a lot of
is,
juicy
there's
things
so
in
much
there.
juice there.
Yeah, yeah. And I think
Yeah.
there's a lot of really interesting, like there's the obvious connection with diabetes and
Mm-hmm.
hypertension with eye health. But I feel like there's some really interesting stuff that we could dive into in terms of like prevention and like using eye health as a barometer of health in terms of cardiometabolic risk. I don't
Mm-hmm.
know. That's sort of what's like in the back of my head.
That would be a very interesting Zoom meeting.
Yes.
Very relatable too, because unfortunately everyone is very high risk right now with cardiometabolic
Yeah.
diseases and things like that. It's not an uncommon conversation anymore.
Yeah.
And it's younger.
And it's happening younger
That's
and
the other
younger,
problem.
which was
Yeah.
what made me think of it. I was like, gosh, if you could use eye health as a
Mm-hmm.
way to improve somebody's cardiometabolic risk, you could potentially prevent cardiometabolic disease and hypertension, diabetes, cardiovascular risk. Like you can improve those markers by focusing on eye health. And
Mm-hmm.
obviously dementia, you were talking about the connection to cognitive health.
Yeah.
That might be an interesting way to sort of grab somebody's attention and get them on board.
Yeah.
Potentially like if they're maybe not as motivated by the risk of diabetes.
Exactly. Unless they're in a very bad state, but that's where you don't want to get that patient.
You don't want to get to that point. I don't want to get to the point where I'm dealing with diabetes that I'm worried about your eyes. Right?
Yeah.
That we've already like, wow, we've passed so many goalposts already. Like if we've gotten to that point. And yeah, I want to see it like before we get there, like how can we mitigate it so that in a couple decades, we're seeing the numbers decline.
Yeah, that is the fundamental goal, is to catch these kids early.
Get these kids in line early.
Get them early. But yeah, I think we're really at that point in time that it shouldn't just be a conversation for your general doctor, I think it should be in all subspecialties where that conversation needs to come into play, where what are you doing lifestyle wise? Yeah. And if it's just that one sentence, and if it's like not a good answer, or you feel like that patient needs that extra help, if you can give them the way to find that, whether it's a book,
Yes.
Just a book. Sometimes it's just a book. I
Yeah.
have had patients that I literally give them a book list.
Yeah.
I'm like, start there. And I've had patients come back to me a year later and they're like, I read that book and guess what? I'm on the Walls protocol because I have progressive MS. I've had that.
Right.
I didn't do a thing. I'm like, well, I didn't do anything. I just said to read a book.
Top 3 books that you recommend? Walls. Our
Walls
favorite.
she saved me. So
if Dr. Terry Walls ever hears this, just so you know, we've got like a fan club right here. Terry Walls is like one of my favorites as well.
She's amazing.
Yeah.
She changed my life, and I'm so grateful that I was actually able to thank her in person. That was like the highlight. It's like, that it's just a book and you can't, it was tangible. It was such an amazing experience for me.
Can I tell you, I've met her a couple of times at like conferences and stuff like that. And you know me, like I'm pretty chatty. I don't often lack for words, and I literally didn't know what to say to her.
Really?
I was actually, there's like 2 people that I've ever been starstruck around. One was Jeffrey Bland and one was Terry Walls. And they're both so lovely that they got the conversation out of me, but usually I am not lacking for words. And I was like, I don't know what to say.
They're pretty much rock stars. So
yeah, they're rock stars. Yeah. They're rock stars in my book anyway.
But so I actually, a newer book which is not a new book, but the Amy Myers Autoimmune.
Oh yeah, I have not read her. I read a lot of her stuff. I have not sat down and read her book though.
I read her book and I like it because guess what? Another link: autoimmune and eyes.
Yeah.
Let's just say that's a very common conversation.
Okay, that's another conversation. Let's also talk about that. So we're going to talk about metabolic disease, and we got to talk about autoimmune health. And let's
autoimmune gets me like chills because it's. I mean, so many times the eye is the first symptom.
Yeah.
Like,
oh, that's interesting. Okay, we have to talk about that another time.
Yeah.
Okay.
So those are, no, you penciled me in. Now you're a professor too.
Yes, thank you. Yes. I'll open up some office hours for you.
I feel like, I don't know. I feel like I need to have your calendar and like put in requests of maybes. And, I don't know. You're a busy lady.
That's exactly what it's like to work with me. I'm so busy.
You deserve it. You're the hardest. I mean, I don't know. We can go into a whole nother conversation.
We could talk another day about managing calendars and how the hell we get everything done and petition for extra hours. I'd like an extra 8 hours in the day. Yeah, that'd be nice.
Yeah, with sleep.
Well, I want the 8 hours so I could sleep.
Yes. I need my sleep. And then I also like again, this is kind of like my personal, I like the paleo cure.
Oh yeah. That's a good one. I have that.
Chris Kresser.
Yeah, I have that sitting
That was
here.
a good one. It kind of shifted me off of Walls a little bit, allowed me to do a couple more things when I was doing her protocols pretty aggressively. But I just like how it's written. Yeah. And then I did read the Dale Brinson book too, The Alzheimer's Cure.
Oh yeah. It's a really good one. I feel like that was a game changer in terms of not only obviously Alzheimer's and cognitive health, but I think it was a game changer in terms of challenging this notion that if you have cognitive decline, there's nothing you could do about it, And I think it was a game changer in terms of helping us better understand how to approach, again, degeneration, neurological degeneration, in a different way. And I think that's really cool. And I think Dr. Neda, you're going to be doing that for us as well.
We have a few other things I need to tackle first.
Few steps first.
Few steps.
All right.
But you should get up.
I'd like my autographed copy of that book when it comes out, just so you know.
Well, same on your end. Yours is definitely coming out sooner.
Who says I have a book?
It's coming. I know it's going to come. Whether it's an autobiography, that could
be like 10 tips for managing a calendar.
No. Between I'm a digital like guru,
I don't know about that.
I changed pharmacy.
I don't know about
Yeah. Yeah. I mean, you've done so much. It's I always like am awed by how much you can handle at once. It's pretty remarkable.
Well, thank you so much. This is why I think, well, beyond the fact that you're fun and funny, I think it's part of the reason that we are friends is because I think we have the same outlook in terms of how to use our training and challenge our training to take it to the next level and just say, hey, this isn't working. And let's figure it out. Let's fix it. Let's make it better.
Yeah. It's it's fear, right? It's all about fear. That's the first thing. When you just put fear to the side and you just say, I'm going to do it.
Yeah.
Yeah.
Yeah. Put fear aside, put ego aside.
Yeah.
Show
and
up
if I
to
fail,
serve.
I fail. Yep.
Show up to serve. Find your allies. Find your people. Your your community. Support and ask for support, and show up every day.
Yeah.
Just show up.
Just keep going. Just keep swimming.
Keep on keeping on.
Anyway, but yeah, I think this was a good combo. I think it just actually made us only want to do more.
Yeah. Cool.
Yeah.
Unfortunately, I have that effect on people.
Yes. I know, Lara.
Let's talk about 27 other things.
Well, that's how your brain operates.
Well, not only that, like, honestly, I'm learning from you, right? Like, because like, you're like saying stuff. I was like, oh crap, holy shit. Like I'm sitting here talking about metabolic disease and autoimmune disease all day long, but I'm not talking about the eye health and how it interplays with that. And it's sort of similar to what I learned when I started learning more about kidney disease. And I was like, sort of, you learn kidney disease and you're like, hey, a few people have that. It's sort of like how we learned autoimmune disease. A few people have that. And more people are getting it. And you're like, holy crap, it's just yet another manifestation of the same metabolic / gut / detoxicity issue, right? Like it's just another manifestation. Yeah. And could we use it as a canary in the coal mines to start to understand what other potential risks are? And are we misplacing our focus just because the numbers for diabetes are so huge, the numbers for cardiovascular disease are so huge, and the numbers for cancer are so huge? Are we sort of being distracted by the sheer vastness of that? And could we potentially reduce those numbers by focusing on these smaller areas? And so that's sort of how I'm like trying to wrap my head around the problem.
Yeah, it makes sense, because going back to, it's not a problem until somebody feels it, right? Or it's in a, but when you go into these subspecialties, the problem is the patient is now feeling it. And then roping it in the opposite way. It's like, it's almost like looking at it the opposite way. You're at the end of that organ, but now we have to go to the beginning. So yes, having subspecialty involvement with functional nutrition and functional medicine, I think, is paramount.
Absolutely.